Bismillah ar-Rahman ar-Rahim. Assalamu alaikum rahmatullah wa barakatuh. I am more than happy to be with you all here, and I would like to thank first the organizing committee and scientific committee for this meeting, important meeting, annual hematology meeting. I will start my presentation. Hopefully it is a summary presentation, very light presentation. You may like it all because it has few new informations. I have no conflict of interest. My talk will cover understanding platelets, some introduction, then source and type on its preparation of platelets products, safety of platelets products, clinical application, conclusion. History of platelets, 1865 and in 1882. When Schultz and Pizarro describes this third group of corpuscular particles in the blood, the platelets. And by 1980, this century, human platelets lysate, one of the platelets products, important platelets products nowadays, prepared by repeated freeze-thawing cycle, and this platelets was found to support proliferation at that time of established cell line and primary fibroblast. As we can see here, this is platelets from inside, and the platelets, which is a very tiny, very important cells, 2 to 4 microliter in diameter, has normal count, as we know, 150 to 450, and usually every day around 15 to 40 times 10 to the power of 9 platelets produced daily from megakaryocytes, and it play essential role in primary hemostasis, wound healing, and tissue regeneration. This is a platelets from inside. We all know that it has lysozyme, dense granules, and alpha granules, but maybe we don't know that it have all these proteins and growth factors and coagulation factors. These very important proteins are important for health of patients, and we may see later that platelets products have a clinical application, which is very important nowadays. Role of platelets, as we all know, the hemostasis, and also that it is release a growth factors, important growth factors, which can lead to support of tissue repair. From where we get our platelets, we all know that it could be autologous or allogeneic platelets, and allogeneic usually are getting it from Buffy-coat platelets or PRP, which from whole blood, or apheresis platelets. Platelets products. Platelets products include all these names. You know all that we have the platelets concentrate, which is the daily use in all hospitals, platelets concentrate. But we have also cold storage platelets, which I don't think it's applied in Saudi Arabia till now. I'm not sure if any hospital applied. If anyone knows that it's applied, you can raise your hand. Not yet, but in practice, but it is good option for us, and this is one of the reasons why I'm giving this presentation. Cold storage platelets is important to be in our blood banks, especially large, big blood banks that if we need it for hemorrhage or bleeding patients. Cryopreserved platelets and also platelets-rich plasma, PRP, serum platelets gel, synthetic platelets, and platelets lysate. Human platelets lysate is the modern now products, which is very important to know about it. As we know, all platelets concentrate are blood products derived from whole blood, and they play a crucial role in treatment of thrombocytopenia. But second one, which is the new one, the storage cold platelets, it's not very new, but it's not used in all countries. We can see that some blood banks are exploring possibility of storing platelets at cold temperature and using it in bleeding patients. FDA defines this cold stored platelets as those stored continuously at 1 to 6 degrees, and it is for specified time, and it is improved viability, and cold storage platelets potentially lead to long shelf life of platelets. Advantage of this cold stored platelets: reduce bacterial growth and better preservation of function, can result in increased cell activation and procoagulant function, and products can be used to treat actively bleeding patients. It is hemostatically effective and have longer potential shelf life. This is why I am talking about cold storage platelets. It is very good to have it in our blood bank for, especially in trauma hospital. Trauma hospital is good to have cold storage platelets, but it has to have nationally agreement and guidelines, and we have the Saudi FDA. They may agree before we have start doing it at our blood banks. As we can see, current, no, it has to be, okay, this first. Sorry, this first. In 2023, US Food and Drug Administration, they provide exception and alternative procedure to allow therapeutic transfusion of cold stored platelets with a shelf life of 14 days, up to 14 days. And this can be used only if you don't have your usual platelets concentrate at blood bank available, if it's not available. But nowadays, in 2026, outside US, the platelets concentrate stored one, the cold one, is used in actively bleeding in Norway. They are using it now routinely, and while in most other countries, in Europe, UK, Canada, Australia, they using it in clinical trials only or in special protocols till now, up till now. Second or third one of platelets product as cryopreserved platelets. Cryopreserved platelets, as we do for packed RBCs, we can do cryopreserved through DEPSO, and it can be at temperature of -80. You need to washing these platelets before transfusion. Mainly, they are using it in military and in certain countries. BRB, as we all know, BRB is used now in cosmetic a lot without even they get approval or any guidelines, clear guidelines, but it's used, and platelets-rich plasma is a concentration of platelets that enhance healing through growth factor found in plasma. And this platelets-rich plasma utilized in various fields, orthopedic, sport medicine, aesthetic medicine, and a lot of other applications can be used, and it is help in regeneration of tissues. Platelets gel, it is like BRB. It's both interactable, but platelets gel, the difference between it and BRB, that you do more concentration activation of platelets, and you need to add thrombin or calcium chloride to make activation and to use it as a gel. Platelets gel is very effective in chronic wounds like diabetic wounds. It's used and it's proved that it is excellent in do regeneration of wound and tissues regeneration. And it's good in healing and regeneration. Other products is the synthetic platelets. Synthetic platelets still under research, but it is promising one and still ongoing research on it. And its potential benefit that it could offer a consistent supply, reduce risk of transfusion-related complication, and potentially be tailored to specific needs. It's usually done through nanotechnology, and it is promising also still ongoing. This, the important one, which I little bit talk on it more than the others, which is the human platelet lysate. Human platelet lysate also, it is a biological product derived from platelets. And it contains rich mixture of protein, growth factor, and cytokines. And it's play a crucial role in various biological processes. It is used in cell growth and proliferation as it's good alternative to fetal bovine serum. They are using it since they discovered it in 1980 for using, but instead of fetal bovine serum in culture, in cell culture. But it is also administered to treat different diseases, such as wound healing, bone regeneration. We will see later on the application, clinical application. How we can prepare platelet lysate? It's easy to be prepared, but need to be controlled also. It's the specific preparation method of storage condition may vary depending on intended application, where we want to apply. The efficacy of platelet lysate depends on specific condition and individual factor. Using pooled donor platelets production may require the implementation of pathogen inactivation. We know that we are using now pathogen activation for platelets concentrate at our blood banks. Also for platelets products, we need to use pathogen activation to reduce infection risk. The process, how we can do it? We can do it through repeat freeze thawing cycles, direct platelets activation, sonication, and solvent detergent treatment. We have to do platelets isolation first, separated the platelets from whole blood. Then we do lysis of platelets to release their contents. Then purification of this lysate to remove unwanted component. Then we can storage at -30 to -80 till we want to use it. We can see here the way of, this is by Bernoff, 30 Bernoff on 2016. He shows a method of how to apply or how to prepare platelets lysate. We get the platelets concentrate. By the way, platelets lysate can be done from new platelets or from expired platelets, and this is what is good about it. If we have expired platelets, we don't have to throw it away. We can use it to make a platelets lysate. Platelets lysate can be done. We get the concentrate, we do freezing step, then we do for 24 hours at -30, then we do thawing at 37, then we do additional step of freezing and re-thawing again, then we do boiling of all this concentrate together, and after boiling of this concentrate, we can do divided it to small aliquots on 150 mils of 20 aliquots if it is 3 or 4 liters. Then we can freeze and thaw again each aliquot. Then we do dividing these aliquots to smaller aliquots of 50. This 50, we do centrifugation for it. We get rid of platelets fragment, and then we get a 3 aliquots from this 50 aliquots of 35 mils. Keep it after doing quality control and release, keep it in the freezer. Whenever we want to use, we can use it. This is if you want to do a large amount of platelets lysate and keep it for a large use in different clinical applications. And what we can find in this lysate, we have a plasma compartment and platelets compartment, and all these proteins and growth factors, we can find them. And in same studies, they just measure the content of each growth factors and protein. This is another method that you can do from it, platelet lysate, and it's a very easy method. You can do it at any blood banks if you would like to do it through tubing, as you do BRB. You can do centrifugation for 10 minutes. Then you do of boiling BRB, platelets count measurement. Then you can put it at freezer, -80 for 1 hour, then at 37 for 1 hour. Then you can do, after sewing it, dividing in 2 tubes, other 2 tubes. And this 2 portion, you also do centrifugation for 10 minutes. All this centrifugation to make lysis of the platelets and get the growth factors. Pass it through filters, specific filters, 0.22 microliter, and then you keep it for use. And this is an easy way to do it for, especially from autologous platelets for patient use, for on-patient use. We had to do the quality control, as I said. You have to do testing of sterility, testing of potency, and viability testing. And you need to take care of platelet safety in general. You have to understand platelet safety for ensuring patient care and reduce complication. Increased storage period, we have, as I said, you can do plasma. You can do, keeping the platelets for more than 5 to 7 days, or you can just explore the way of doing it more safe. This one. Okay, you need to know that there is a variability of efficacy of platelets content, and according to from which patients or donors you are getting these platelets and how you are preparing the platelets products. And you need to choose the right products for the patients, for right patient. You need to use the personalized therapy, personalized transfusion for each patient, and to take care of reducing risk of rejection by matching platelets. We have to put in our mind the risk of complication, which we can face with platelet concentrate, you may face it with platelets also products. Clinical applications, this is very important part that we know all that it's for management of thrombocytopenia and what's doing thrombocytopenia, and I don't need to talk about this because you all know it. But other application, which is very important nowadays, is the application in surgery and trauma. It minimizes bleeding, promoting healing, and improve surgical outcome. Also, you can use in regenerative medicine and wound care. Healing properties of platelets, that platelets can significantly heal, having healing properties, making them essential in regenerative medicine. It has tissue regeneration, accelerate wound healing. Especially platelet lysate, you can apply it on wound healing for chronic wounds. As I said about platelet gel, platelet lysate is better than platelet gel in chronic wounds and also in surgical incision. It has been used in clinical application and promote faster healing and reduce scarring of surgical procedure. In bone grafting, they are using it also combined with bone graft to enhance regeneration and improve healing of bones. Also joint repair, it's also lead to repair, cartilage repair, and reduce pain. Also, platelet lysate can be applied also more than regenerative medicine, stem cell therapy. Platelet lysate can be used as supplement in stem cell therapy to enhance cell proliferation and differentiation. It is also used in tissue engineering and in cosmetic procedure. It's also have been used, and it is used in facial rejuvenation and hair restoration. The most important application, which is nowadays highlighted, is the use in neurosurgery and neurological disease. It's very important to look at this part and do more research. Platelet lysate has shown potential application in field of neurological disease and in tissue regeneration and reduce inflammation. They used it in brain injury, and it showed that it helped in reduce brain damage and improve neurological function. And this they're still doing a clinical research on this part. And also they are doing, again, a research and continuing clinically doing on spinal cord injury in regeneration of nerve and also in reduce inflammation. And also it is a neurodegenerative disease used, and this is still under research, but it's very important points to consider. For just reducing Alzheimer's disease, it is slow progression of Alzheimer's disease, and it's used also in Parkinson's disease, that it help and promote survival of dopamine-producing neuron and improve motor function in patients with Parkinson's disease. And this is a very attractive application. We need to think about it. In summary, platelet lysate, it is a natural product derived from human platelets, making it generally well tolerated, promote healing, enhance tissue regeneration, help reduce inflammation and scarring, and numerous clinical trials are currently investigating efficacy and safety of platelets in regenerative medicine and neurological disease. Future direction, we have to think about the emerging technology to use it in this platelets product and improve preparation technique. We need to look at improved techniques and diverse medical application, which is promising for applying platelets product treatment. Research is very important to validate this platelets product and that to have impact on future guidelines how to use this platelets products. In conclusion, new clinical application of platelets products in complex surgical intervention improve recovery and outcome, and the methods of preparation of platelets concentrate in human platelets lysate influence protein and growth factor content and profile. Donor characteristic, as we know, it's influencing the products also, age, sex, content of growth factor. This is important for preparing platelets lysate and other platelets product. Ongoing research is uncovering new ways to utilize platelets products, expand their role in modern medicine. By this, I say thank you for all.